welcome back to the Coffee Break Podcast. Wherever you are, whether you're listening or you're watching, I just really hope you're having a great week. And I will tell you, I'm having a great week and a great day today because not only do I get to interview and have a coffee chat with Dr. Helene Burns, the Chief Nurse Executive at AtlantiCare, but Helene happens to be a friend of mine, and we've been colleagues for a long time. I guess we start out as colleagues, and then we became friends. So, Helene, welcome to the show. Thank you so much for being here.
Well, first of all, thank you for inviting me. I'm so excited to do this with you. And yes, we've been colleagues, but more important, we've been friends for a long time.
Yes, and it really started because I used to host my own events. Okay, in Atlantic City, because I'm from Pittsburgh. Helene's in New Jersey. So at Atlantic City, we would host these events, and I would have nurses, these are bedside nurses. They would come to my events. And we had a couple of nurses at the time. You were working at Kennedy, which then became Jefferson, and now you're at AtlantiCare. But these nurses went back, and they told you about me, and you were having an event. And I was invited to, I think it was a keynote at your event. And that's when I first met you. And my first conversation with you was so comfortable, so fun. And I said, oh my gosh, I love this woman. Like, we're going to be friends. I could tell. Like, I am so into those people that make you feel so comfortable, even though, you got this executive role, you didn't act like it. You were just so down to earth. And then, of course, Helene, our conversations turned into conversations about grandbabies. And so I had my grandbabies first. And then
I was jealous.
Very jealous.
You were first.
I was. But then Helene has the most beautiful little grandson. Absolutely adorable. So in addition to all the amazing things that Helene does, she's also a grandmother. Well, let me tell you, though, about some of those amazing things. Helene, as I mentioned, is the Chief Nurse Executive at AtlantiCare. And she went from Kennedy to became Jefferson, and now she moved over to AtlantiCare. She also is a fellow with the American Academy of Nursing, and she's also recently been inducted as a fellow at AONL. And this happened at their conference in 2024. And I was in the audience, and I watched Helene walk on that stage and receive her award. And I was really proud of her because Helene's done just amazing work as an executive leader.
Thank you. Thank you. Thank you. It was a very special day, and so was for the Academy of Nursing. You have to pinch yourself when you get that opportunity to have that level of accolades and to have your whole family there. It's also exciting.
It is exciting. It's really cool. And there's an element of, oh my gosh, I am standing among all these other amazing nurse leaders, and, a little bit of, am I worthy? Because I know myself when I was inducted as a fellow into the Academy, I'm just standing there in awe of all these amazing leaders who have done such amazing work for our profession. And then there's a recognition that, they're probably saying the same thing about me and everybody else. And it's just, I don't know, I guess it's sort of the way we are. And, Helene, I really thought about, how do I want our conversation to go today? Because again, you and I have known each other for a long time. One of the things that I love about you and your work, and I've seen this consistently over your career, is that you understand what it takes to be that leader who can cultivate a healthy work environment. And, you might even say that, these are great leaders who are able to do this. Can we just maybe start with that conversation? Can you give us some examples of leaders who have been able to do this and do this well?
So, I think I've had such an opportunity here in New Jersey. I've been very involved over the years with the Organization of Nurse Leaders New Jersey, ONL New Jersey, which is actually an affiliate of AONL, American Organization of Nurse Leaders. I've been on the board now for a number of years, probably almost 10 altogether. I am the past president of that. Back in 2006, that core group started to talk about, actually, our conversation was about pending staffing ratios. And we started to talk about what does it take to have a healthy work environment. And that evolved into, we have councils here in New Jersey, many hospitals. It's actually, I think about 60% of the hospitals now have councils for healthy work environment. And they are co-chaired by a clinical nurse and a nurse leader, the
Wow.
CNO. And it is, I've learned so much from the evolution of that, not only at my organization, but how we have all evolved that. And, what has emerged is some really great leaders. When I think about my board members who are CNOs, I think of Dr. Mary Jo McLaughlin. She is from Huntington Medical Center. She just embraced the concept with her staff. And while none of our work environments are perfect, nobody's is, a healthy work environment is so important. And understanding what are the barriers to get to there, and how do we as leaders help to get rid of those barriers. Another one of the leaders here in New Jersey is Brandy Featherman, and she's the CNO at Morristown Medical Center, which is part of Atlantic Health. Once again, what I see is CNOs who don't just talk the talk, walk the walk. You've got to do both. You can't just talk about a healthy work environment. You've got to get in there with the staff and figure out how to make that happen, whatever that means. And it really could mean relationships among nursing staff, among, with physicians, with any of the providers. How do you cultivate that so that people can speak up and do the right thing and be in an environment that they're happy about.
Okay, you said a few things that I actually want to explore a little further. You did something really powerful. And I think every, problem solving begins here by asking the questions. You ask the questions. What does a healthy work environment mean? How do we know when we're in a healthy work environment? So you always start by asking a question. And what you did was you just didn't ask all the leaders. You said CNOs and those nurses who were actually delivering the care, because it can't just be a group of leaders sitting around a conference room saying, how are we going to make it better here? And how are we going to improve the environment? You have to involve the people at all levels, really. We sort of call it our top down, bottom up, everything in between approach. You have to get their buy-in. And you mentioned too, relationships, especially I think right now, that's the key to tackling some of these challenges that we're experiencing in healthcare. It's really that collaborative problem solving. And that's where getting together with your physicians and your providers and, other members of the interprofessional team to take a look at a problem, an issue, and how do you solve that problem together under that umbrella of a healthy work environment. So can you talk a little bit more? Because I know you've done this well. You and I had a conversation when we were at AONL about these partnerships with your physicians as part of this healthy work environment.
Yeah. I remember the conversation, and here's how I feel about it. I think that it really is a dyad relationship, the physician and the nurse, whether that be at the bedside with that individual patient or at an executive level. I've always said that it's very important that the CNO have a collaborative relationship with the chief physician, because as we act, many times that's how the organization acts. They watch us, how we treat each other, how we stand together on issues. And sometimes, behind the scenes, we may disagree, but out in front, we have to be an equal partner. And I love when medical staff treat nurses as a partner, not as a subordinate, but truly as a partner. I remember, and I was with Jefferson, and I first had gotten my DMP, and in public, every doctor would call me Dr. Burns.
Wow.
And that meant so much. That really meant, it's not a medical degree. It's a doctorate in nursing practice. I realized very quickly that they were as proud of me having that degree as I was. And it set the tone for, we are on the same page. We are equal. And when we treat each other as equal, then the expectation is everybody treats each other as equal, no matter what your role is. And that could be, clinical or even non-clinical, but, treating each other with that respect. That is healthy work environment. In a nutshell, so right. It really is.
Because, people might argue that, we're not equal. I have this responsibility and you don't. And, people will nitpick that and they'll push back on that. But I think, again, under the umbrella of a healthy work environment is that every single person on the team, and when you look at the entire interprofessional team, it's that they recognize that everybody has a different role. Like we all have a different role to play. Physicians have their role, nurses have their role, respiratory has their role, the administrators have their role, facilities manager, they have their role. Everybody has a role to play. And every role is valued. When you have that, where every role is valued, then you can, break down that hierarchy and where some people perceive that their role is more important than another role because it shows up.
Yeah.
It shows up on how they treat people. And I love that you said, as soon as you got your DNP, that they started calling you Dr. Burns. That is so cool because I don't always hear that, or I don't often hear that they're recognizing you for the fact that you do have a doctoral degree. You may not be a medical doctor, but it's an indication of respect, respect for your role. And even myself, when I meet someone, Dr. Helene Burns, like if I'm meeting you for the first time and I wait for you to tell me to call you Helene, and somebody will keep calling me Dr. Thompson, and I'll say, and I'll never forget, this happened recently where a leader we've been working with, I've said to him probably 27 times, Ken, please call me Renee. And he said, out of respect for you and your degree and your hard work, basically, nope, I'm going to keep calling you Dr. Thompson. Like, okay. But getting back to that, building relationships and creating these dyads, you and another, physician executive, you can have your debates behind the scenes, but what you need to show up as a united force. Absolutely. That you're in it together, because what does not help create a healthy work environment is when, we demonize any one role, because I see that all the time. It's the physicians, or, it's the nurses, or, it's, fill in the blank. But that you guys aren't talking badly about each other behind your backs, that you're coming together. And if you have an issue, you're talking through it. And you've done that well. And, so you mentioned Brandy, you mentioned Mary Jo. Can you tell us, I don't know, Helene, in your experience, what makes a leader great? What makes a leader? Like, what are some of either the skills or the characteristics of someone in a leadership role that truly helps them to be a great leader, one who's respected and cultivating a healthy work culture?
When I think about it, I always think it's listen first. Don't talk, listen first. And develop that relationship so that you develop that respect, the mutual respect. It's not that they respect me, it's we respect each other and value one another. When people understand, or people know that you value them, you respect what they have to say, you listen, and sometimes you have to clarify. Sometimes the best question I ask is, so what did Helene say about that? And they'll tell me, and it was like, oh, I never said that.
Yeah.
Here, let me clarify that for you. And, it's the people need to understand the why. Why are we doing this? Why is
Yeah.
this so important? You know, understanding the why is just, you know, it really helps you to then clarify and develop that relationship. I think when you're a CNO, you know, sometimes people will say, you know, we don't see you all the time. We don't see enough of you. And of course, you get the guilt with that. But when they know that they can touch you, call you, get a clarification from you, and when they see you, they feel comfortable. You know, one of the best things that happens is if I walk down the hall and people are coming towards me and not trying to run away. If they're
Mm.
running away from you, then you're not developing a relationship. If they're running towards you and they look and they smile, that is always, you know, because I'm new to Atlanta Care. I've only been here about 6 months. So I don't know everybody and everybody doesn't know me yet still. But when I walk down the hall and someone looks up and smiles at me, I know that I'm making a good connection. And that opens the door for me to say, hey, how are you? How you doing? What do you need from me? You know, that type of thing. Because that's when you start to hear what the issues are. You know, it opens the door.
You just blew my mind. I had never really thought of it that way. But how you know, and this is all about self-awareness too.
Mhm.
Okay. You have to turn the mirror back on yourself. It's, you know, essential to be a good leader. But I never thought of it in this way. As you're walking down the hallway, and I'm even thinking like in the lobby or anywhere in your organization, if people run towards you, that's a good sign. If people run away, they turn and go the other way, that might indicate that there are some issues. And then it's up to you to then figure out, why are people turning away from me? You know, Helene, when I was a brand new nurse, I was scared of my manager. So this is even just the manager. The manager, when she would come out to the nurses station, I would find a reason to step away from the nurses station. I was just intimidated by her. The only time I ever really talked to her was if there was an issue or, you know, my annual performance review. And I would have like heart palpitations before I'd go and meet with her. I don't think she knew anything about me. You know, I was one of how many nurses she hired that year. And, you know, so it's not to say, you know, that's the opposite of a good leader. Well, maybe I am saying that, but I never thought of it in the way you described it, as when you walk down the hallway, are they moving towards you or are they moving away from you? And I just love that simple sort of assessment.
Yeah.
So pay attention. If you're listening to this, pay attention what people do when you're walking down the hallway.
And you can see it in nurse managers. When a nurse manager is truly connected with their staff, the staff aren't complaining about the nurse manager all the time. They empathize with the nurse manager's job, their role. And it's the same type of thing. They're willing to help each other out. You know, I think that leader, that unit-based leader is so critical for development of that healthy work environment. Because if you know your staff, they trust you, you trust them, you have an open relationship, you know what's happening. You know that if there are issues internally with staff members who don't collaborate well or don't work well together, and you address that. That's when you build that healthy work environment. You know, it takes everybody. It's a village to get to really that environment that's really very positive. And I think a unit leader, that manager, is very key to that. And you have to have insight. You know, you have to be out there and seeing what's happening.
So I'm curious. All right, you were at Kennedy and then Jefferson for a really long time, and now you're at Atlanta Care and you're new there. You know the importance of building relationships, but you're also new in your role there. And usually when you bring in a new executive, you know, there may be, you know, problems that have been piling up that they're waiting for you to come in and all of a sudden magically solve. So how do you prioritize, you know, doing the work of a CNE at the same time doing the people work that we've just been talking about is equally as important, and building that relationship with your key stakeholders, those, physicians and some of the other people in your organization. How do you prioritize that? Because I can only imagine what your days are like.
I think it just having the experience of being a CNO over 10 years, that helped me to just really hit the ground running and get started. I knew what the issues were, or what I anticipated some of the issues would be. My biggest concern was I wanted to know what the staffing was like. What was, did we have enough staff? We're coming off of the pandemic still. So do we have enough staff? Have we been relying heavily on agencies still, which we had at the time when I started. We have been leaning down agency because I meet every single week with the recruiters and the directors, myself, and we talk about, where are we with positions? What about the hard to fill positions? What can we do about them? I said right at the front, like, I want same day hires. I want, if we do an open house, I want to hire that person right there, on the spot. And so just pivoting, and doing things quickly sometimes, and sometimes in an organization, when you're new, you're able to do that. You have to be careful to not always say, well, we always did it so great over there. And sometimes you bring your best practices with you, but, you also learn very quickly. So, I will tell you my number one priority was staffing, to make sure that we did have adequate staffing, appropriate staffing. And where were the barriers? Where did we have to focus our time? I quickly met with, I'm luckily surrounded by great universities. I quickly met with all the deans. And each dean told me that they didn't think that they were the priority for our organization. It was kind of funny because I thought, well, you all said that. That's not true. And each one is truly a priority to help us with getting new nurses into the organization. So, it's just, I think that the experience I've had over the years helped me to prioritize very quickly. For us, nurse managers some of our nurse managers had too large of a span of control. One nurse manager, 120 employees. How does that work? Not well.
Yeah.
And have to do all the payroll. So, early on, very early conversations with nurse managers telling me that, Sunday payroll means I don't have Sunday off because I'm doing payroll for all those employees. So quickly, and I did so in a budget neutral way because I kind of know how to do that. But we were able to give the nurse managers associate nurse managers. And if they had more than 40 or 50 employees, they had another associate nurse manager. So anywhere from 1 to 2 associate managers. And the one thing I said is, I don't want everybody on the same shift at the same time. And I want you visible for the staff. That's the purpose of it. And then we elevated some of our unit secretaries to be coordinators who are now doing payroll.
What?
Yes.
That's awesome.
So take that administrative burden off the nurse manager, because really the most important thing for the nurse manager to do is to be on the units. We also had a problem with they were going to meetings all day long. We had to categorize all the meetings and we cut many of them out. So, because the most important thing for the nurse manager is to be on that unit with their staff. So they were the very early things that we did to make an impact. And when you do that, people notice it. Your staff notice it.
They see that you're doing something because, and what I've learned about you over the years, Helene, is you're not paralyzed by perfection. You're not waiting until, you have every piece of information. Like you're right. You've been an experienced chief nurse executive for a long time. You've been in healthcare for a long time. You're doctorally prepared. You're coming to this position with experience and knowledge already that you can apply immediately. Like you said, the same day hires, focusing on staffing, working with your deans, because that's a role that I had before I started my company, was I was the director of academic service partnerships. So I worked with all the schools of nursing that would bring their students to our organization and, really worked with them. And I had to chuckle a little bit because when they say, oh, none of them think that they're the priority. In our situation, we had one that everybody thought had the priority over everybody else. And there was some conflicts with that. And, getting into that role, I had no idea that these things were happening. And then, how do you navigate those, those waters when you've got some long-standing, well, that's the way it's been done here for years. And then you just come into it with fresh eyes. And I think having an open mind and maybe an innovative mindset too, to just try something to see if it works. And it sounds like you've really done that. And I so appreciate the work that you're doing with your nurse managers and really looking at the span of control, the scope of their work. Yeah, I was a nurse manager. It was me. And I had 75 employees. And I can remember coming in on Sundays to start payroll before payroll Monday hit. And that's not a good place, and I burned out very quickly. But you're doing a great job with that. All right. The last thing I want to ask you, you have your finger on the pulse of what's happening across the country. And I know the work that you've done with the New Jersey Organization of Nurse Leaders Group has just been fantastic. And it gives you that opportunity to, not only see what's happening in New Jersey, but your work with AONL and the Academy really gives you a sense of what's happening around the country. Are we making progress? Are things getting better out there when it comes to a healthy work environment? Or do you think we're at a standstill?
To answer the question, are we making progress? The answer is yes and no.
Right.
Okay.
And I think that there are great best practices out there that others need to just find out about and grab. I think that there are still organizations that are struggling. I think there's CNOs and nursing staff that are struggling. We've not gone over the rainbow yet. I think we're on the trail. I think many more are understanding that our roles as leaders is to develop that healthy work environment. If we pay attention to that, then our clinical staff can do all the right stuff that they need to do. They can care of the patient if we can care for them. And that's really sounds so simple and it's so hard to do, but it's so essential for the work that needs to get done. I think that we're making progress. I love that we're talking about healthy work environments. I love that we're talking about behaviors and what's appropriate and what's not. Because for many years, and you and I have been in nursing a long time, we didn't even talk about that stuff. Nurses eat their young, and I remember myself being a young nurse and people being mean to me because I didn't know. And you don't know what you don't know, and you're going to learn. And that's, we've all been in that space. So I think we've come a long way, but we still have a long journey to go. And the more we talk about it, the more we do things, the more we find out who's doing it well and how are they doing it. Going to a national conference and this being a topic, I loved that focus of AONL was really one of the large focuses this past AONL in the spring was about the nurse manager and the role of the nurse manager. Such a crucial role for a healthy work environment. And we have to take care of the nurse manager so they can take care of us. So, it was just, to me, it was like they were spot on to talk about that one.
Oh my gosh, I could not agree with you more. On many levels here. Okay, first of all, you're absolutely right, because what I've seen is we are making progress, and there are pockets of amazing transformations in some organizations, even if it's the organization in some service lines or departments, where the organizational executives, they get it. the culture, the environment is just as important as the services that they're providing. So if you have an executive team that gets it, it's so much easier. But we also have pockets and organizations where they're still sticking their head in the sand saying, we don't have a problem here. Everything is just fine, and that's a whole other conversation. But knowing that the frontline manager is really, if you're going to start somewhere, start there, because one of the things that we've noticed as we've been surveying our clients and our community, and when we do webinars, we're always asking, questions. A lot of the organizations out there, when you take a look at their frontline nurse managers, 50% of them have less than 2 years experience. And a lot of them learned how to be leaders during a pandemic when everything was in crisis mode. So to your point, we need to focus on those nurse managers. And I love what you're doing at Atlantic Care, where you're looking at their span of control and you're giving them the support that they need. And thank you so much for you're going to be the manager. You're going to have 2 assistant nurse managers, but you all can't work Monday through Friday daylight. I mean, you need to have some coverage, either, you decide weekends, evenings, nights, whatever makes sense for you. But there's got to be that, you have to spread the wealth, as they say. But we are making progress, bottom line. We still have a ways to go. So, Helene, if someone, let's just say, they're a new chief executive and they're starting, at a hospital that they've never worked at before. They're brand new. So that was you 6 months ago. And they're listening to this episode. What advice would you give them, being brand new to an organization as a chief nurse exec?
I'll go back to the listen first.
Yeah.
Listen first. You don't have all the answers. Find out what their issues are. That helps you to prioritize, but find out what the issues are. Listen, hear what they have to say. You get a sense of the culture by doing that. You start to understand what the priorities are. We don't have all the answers. Oftentimes we know how to find the solutions, right? And just listen and prioritize from there. I just, after all these years of being a nurse, 40 plus, I still love it. I still love what I do. I love coming to work every day. We all have stuff we're working on and things are not perfect, and that's life. But nursing's such a wonderful profession, no matter what level you are, how you hit in our profession. It's just a great place to be. And we just need to find the jewels and go find the best practices and implement them. People are doing great things with nurse manager roles today. And, just pay attention and do the right stuff. And then ultimately, then you have clinical staff who love coming to work, love taking care of patients because you've provided that great, healthy work environment.
Yeah, so wise. And I love how you started by saying, just listen, because if you listen, they will tell you what they need. But sometimes we feel like we have to go in there and just start doing things, fixing things. We're a bunch of fixers, especially if you're in a leadership role. We're a bunch of fixers. But it starts by making sure you're fixing the right problem. And that is by truly listening. So, oh my gosh. Helene, thank you so, so much for being a guest on this show, for all the great work that you're doing now at Atlantic Care and the amazing work that you've been doing at ONL New Jersey. Thanks for being my friend. I so appreciate just the years that we've been doing good work together and sharing pictures of our grandchildren on text messages and on Facebook. I think you're an amazing human being, and very honored to call you friend. So thank you for everything that you're doing, Helene. And if people want to connect with you, what's the best way?
Helene.Burns at atlanticare.org. And I am on LinkedIn. So come find me on LinkedIn. It's it's always a pleasure when someone reaches out. I remember one time I had a very bold nurse manager who worked in another organization, and she sent me an email and said, "Would you be my mentor?" And I
Aw.
remember this was several years ago. I remember my secretary coming in and she's like, "You're busy. You don't have time." She's like, "You don't have time for this." I'm like, "Oh, I made time for this." And
Yeah.
here I've met somebody. She's now in a director role. She's doing a phenomenal job, and she wants to be a CNO someday. And someday she's going to be a great CNO. And it's like giving people that time to be there for them, to mentor them. And it's part of our job, you know? Yeah, always a pleasure. Always so much fun talking to you.
I know we always have a good time together. And I look forward to continued conversations with you, Helene. And again, thank you for being a guest on the show. And I know how busy you are, but you're always there for the people who need you. And have always appreciated that about you, like this mentor or person who reached out to you to ask you to be a mentor. Yeah, that's just kind of who you are. And, circling back to the beginning, we talked about what makes a great leader. Well, there you go. You just explained what makes somebody a great leader. So thank you. And thank you, listeners. If you're listening or you're watching, thank you for being here. We know there's a lot of noise out there right now, and you have choices on how you spend your time. So if you're listening or you're watching, thank you for spending your time with us. And if you like this episode, if you could please rate it, post a review. I'd be so incredibly grateful. And make sure you share it with others. We have important work to do in healthcare. There's nothing more important right now than the cultures, a healthy work environment. So hopefully you learned a few things that are going to help you to make yours just a little better. Thanks, everyone. See you next time.